Hi everyone, I'm very super excited to see you again. Today's topic is chronic renal failure. Let us start the topic. Definition of chronic renal failure. Here what happens, there will be the disruption in the function of renal tissue. Chronic or irreversible renal failure is a progressive reduction of functioning renal tissue such that the remaining kidney mass can no longer maintain the body's internal environment. Next, etiology. Chronic glomerulonephritis, acute renal failure, polycystic kidney function, obstruction, pyelonephritis and nephrotoxins. Next, risk factors. Diabetes mellitus, hypertension, lupus erythematosus, polyarthritis, sickle cell disease and amyloidosis. These are all the risk factors which can aggravate the these are all the clinical conditions which aggravates the chronic renal failure. The chronic kidney disease mainly due to traditional risk factors and novel risk factors. Traditional risk factors such as lifestyle factors. If there is a disturbance in our lifestyle habits, hypertension, diabetes or insulin resistance, dyslipidemia and malnutrition. Whereas a novel risk factors such as uremia, pro-inflammatory milieu, volume overload, disordered mineral metabolism, electrolyte imbalance, anemia, sympathetic hyperactivity, RASS activation, endothelial dysfunction, protein energy wasting, vitamin D deficiency, oxidative stress, increased FGF23 and decreased clotho. This leads to the heart failure, mainly 4 complications such as dilated cardiomyopathy, left ventricular hypertrophy, cardiac arrhythmias and arterial disease. Pathophysiology. Mainly 2 conditions affect to the chronic kidney disease, diabetes and hypertension. In case of these major 2 conditions, increased RBF and glomerular hyperfiltration rate. In case of hypertension, there will be the more overload of sodium, more retention of sodium. Thus, the glomerular hyperfiltration and sodium retention leads to increased tubular reabsorption. There will be the increased in the oxygen consumption. And if decreased nitric oxide, increased RAF, insufficient HIF activation or decreased AMPK, and in case of tubular interstitial injury, microvascular rarefaction and glomerulosclerosis, there will be tissue hypoxia. As there is a oxygen supply decrease to the tissues, thus it finally leads to chronic kidney disease. Chronic renal failure, mainly clinical manifestations. What are the main clinical manifestations? There is a renal insufficiency, headache, decreased ability to concentrate urine, polyuria leads to oliguria, increased bun and serum creatinine, edema, GFR that progressively decreases from 90 to 30 ml per minute, mild anemia, increased BP leads to hypertension, weakness. And some of the common symptoms we can observe in CKD such as fatigue, ammonia smelling breath, loss of appetite, foamy urine, difficulty urinating or frequent urination. Pathophysiology of heart failure in CKD progressing to end-stage kidney disease. How the CKD it leads to end-stage kidney disease? As there is a pressure overload continuously or progressive volume overload, and in case of clinical conditions such as cardiomyopathy, if there is ischemic, non-ischemic or uremic, there will be the additional risks such as diabetes, obesity, poor fitness, anemia and iron deficiency, bone and mineral disorders. Along with these additional risk factors, there will be concurrent conditions such as CAD, coronary artery disease, MI, myocardial infarction, infiltrative process, atrial fibrillation and mitral or aortic valvular disease. There will be the symptomatic heart failure, leads to reduced LVEF or preserved LVEF. It leads to CKD, finally leads to the end-stage kidney disease. It requires hospitalization confirmedly if the patient may lead to sudden arrhythmic death or pump failure death. Medical management. Medical management involves preserving the renal function and delay the need for dialysis or transplantation. Here, we need to maintain the kidney function by reducing the diabetes or BP, controlling of BP. How the hypertension can be controlled? By using the diet, maintaining the client condition and use of medications can help in reducing the hypertension. Next, elevate the extrarenal manifestations. For example, by using the emollients or some of the things which can reduce the renal failure. Improving body chemistry values. How we can improve? By using the dialysis. The dialysis is of mainly two types: peritoneal dialysis and hemodialysis. Peritoneal dialysis is again subdivided into four types: continuous ambulatory peritoneal dialysis, automated peritoneal dialysis, intermittent peritoneal dialysis, and nightly intermittent peritoneal dialysis. Thus, regarding this dialysis, we can see in the next video clearly. Health education. Health education here, the main thing is care of vascular access. Care of vascular access in the sense, if the patient need to undergo the dialysis, they need to keep the fistula. So the fistula care must be important. We need to avoid for checking the BP and all, we need to avoid by not to tie the BP cuff to the particular hand. Detection of complications. Early detection of complications helps to reduce the risk conditions. Diet. We need to explain the client to eat animal proteins such as meat and chicken to add more potassium in the diet. To limit the fluid intake. As there is a shift of fluid intracellular and extracellular, we need to limit the fluid intake to avoid the excess salt. And the client need to reduce the food content that contains the phosphorus such as milk, cheese and the nuts. Finally, nursing management. First of all, to reduce the complications and to recover from the chronic renal failure, we need to assess the client condition clearly and perfectly so that the client may not undergo so many complications. Deficient fluid volume or excess fluid volume. In case of these conditions, we need to maintain the body's weight for the client so that the increased or decreased fluid volume we can observe easily. Imbalanced nutrition less than the body requirement. As there is a increased fluid volume in the body, it leads to edema, it leads to decreased appetite. So we need to provide the small and frequent meals, and we need to serve the client in an attractive manner so that they can eat easily. Constipation related to medications, fluid and dietary restrictions. The use of laxatives may help in reducing the constipation to the client. Fatigue related to anemia and altered metabolic state. Risk for impaired skin integrity related to edema and the dry skin. The use of oil products or emollients helps to reduce the dry skin. Risk for compromised family and individual coping. Risk for ineffective family and individual therapeutic regimen management. Here the client and family members both will face so much stress and anxiety, so that we need to explain the client and family members regarding the patient condition and how the disease condition can be reduced by using the medications and other measures, so that the client's stress level will be reduced easily. By using or providing the recreational activities or psychological support or educational support and emotional support helps to reduce the disease condition. Final one, risk for infection. As there is a use of indwelling catheters and all, there will be the increased risk to get the infections. So the early antibiotic regimen or antibiotic schedule can be used with the doctor's prescription. The antibiotics must be prescribed to the client so that the infections can be reduced easily. Thus, in this today's topic, we had completely covered the definition, etiology, risk factors, pathophysiology, clinical manifestations and the management. If you have any doubts, please give your comments. If you have not yet subscribed, please subscribe to this channel. Thank you one and all.